going to give you my speech therapy secrets for how to address velopharyngeal dysfunction.
Speech secrets.
Velopharyngeal dysfunction describes problems controlling when the air goes through your nasal cavity when you're speaking. So how do you know if you have velopharyngeal dysfunction? Here's a few giveaways. Speech can sound overly nasal. You might have air that comes out of the nose when you're speaking on sounds other than M, N, and ing. You might also have difficulty making strong plosive consonants like P, T, or D, and that's because they require a buildup of oral pressure to produce. And you might also run out of air quicker when you're speaking because the air is also coming out the nose, making your speech less efficient. Lastly, problems with the soft palate can cause food or drink to come out the nose when you're swallowing. Have you ever laughed while you're trying to take a sip and it comes out your nose? That's because when you swallow, your soft palate also closes off your nasal passage, and with a little bit of discoordinated movement or an interruption in that movement, it can cause the food or liquid to push right out the top. It burns when that happens, doesn't it? So what causes nasal sounds? Nasal sounds occur when air moves through your nose and the sound bounces around or echoes in your nasal cavity. That's called nasal resonance. In English, nasal resonance naturally occurs with the sounds M, N, and NG. Can you tell the difference between your oral versus your nasal sound, or your oral and nasal airflow? On the roof of your mouth in the back, you have a flexible flap that's called your soft palate, or your velum. It also contains muscle tissue. The dangly thing in the back of your throat, that's called your uvula, is attached to your soft palate. When the soft palate doesn't close, air escapes into the nose, causing nasal sounds. Neurologic disease, strokes, and brain injury can affect your soft palate movement and control. Individuals with cleft palate can also have velopharyngeal dysfunction, but this is due to structural differences or mislearned sound placement errors. Let's go back to that sound ah and What do you feel in the back of your throat when you alternate between those sounds? Ah, ah. What I'm hoping you felt is the soft palate moving up when you make the ah sound to close off the nasal passageway. It should close up and seal against your pharyngeal wall or the back of your throat. Try looking in a mirror to see if you can see the movement of your soft palate. Saying a series of sounds like ah, 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 ah might make it easier to catch the motion when you look in the mirror. So here are 4 exercises to improve control over your nasal resonance for folks who have normal velopharyngeal structures but abnormal movement. I'm so excited! So first exercise, we're going back to our palate lifts. Take a deep breath and we're going to alternate between an oral sound and a nasal sound. Ah, ah, ah. And now you're going to put your hand on your nose and continue the exercise. You should feel the vibration on the nasal ing sound. Ready? Ah, So that vibration, that nasal vibration, should only be on the nasal sound. If it's on the oral sound, then you know there's some air escaping when it shouldn't. Let's try it the same strategy here with the sound M and P. You should have noticed that during the M sound there was a vibration, but the P sound had no vibration. Let's try it now with the word mom, but this time you're going to put your finger below your nose. When you say the M in mom, you should feel a little bit of warmth on your finger, and that's the air coming out your nose. But when you switch to the vowel O, then the air will stop. Mom. And the air comes back again at the end of the word because it's an M. Exercise number 2, blowing through a straw. Damn, that means I need to get a straw. Blowing through a straw encourages velopharyngeal closure because you have to build up pressure in the oral cavity to be able to blow out the straw. And to challenge the strength of the velopharyngeal closure, then you can pinch the straw or you can blow bubbles into water, and that forces the velum to really maintain its tight seal. Careful not to fill up the water too much. I can feel my soft palate having to stay closed while I blow. So those would be considered strengthening exercises if the velum is weak. Here's an expert tip. One way you can trick your soft palate into closing is by pretending to yawn, or at least pretending that you're starting to yawn. During a yawn, the velum goes up naturally. Try it now. Could you feel the movement in the back of your throat? If you're having a hard time blowing bubbles, try pretending to yawn first and getting the back of your throat in that position. Then start to blow the bubbles. Let me know in the comments if it worked for you. Now, all this exercise stuff is great, but if we really want to make a difference in the way our speech sounds when we're talking, then we have to practice resonance exercises with actual speech. For each person, what you practice might look a little different. Do an inventory. Figure out if there are certain sounds that sound more nasal than others. You might have to Google an articulation list and play around a little bit, trying different sounds in different positions in a word. Say, for example, you notice that the L sound is nasal, more nasal than it should be. Instead of saying a crisp "oh," it sounds a little more like "oh." The first step would be practicing making this sound in isolation with the appropriate oral resonance. You can use that cue of yawning, like I talked about earlier, to help the soft palate close. Pretend like you're going to yawn, get in position, then make the L sound. Oh. Here's another trick for a little bit of self-feedback when you're practicing for the ambitious folk. If you put a tube from your nose to your ear, you can hear when you're having nasal emission with the different sounds. Here we go. You're going to see it. I'm putting this in my nose on the internet. This is the stuff that I do to spread speech therapy through the world. You're welcome, or I'm sorry. Once you have the tube in your nose and in your ear, then try making your target sound. Oh. If you're making the sound without any nasal emission, then you won't be able to hear it in your ear. Now if I switch, oh, that's quite loud in my ear. Or if I try it with the word mom again, mom, I wish you could hear that. You can totally hear the sound, the vibration coming into your ear when it gets nasal. Once you've figured out what the troublesome sounds are, and let me be honest, it could be all sounds are troublesome. They could be sometimes you make it accurately, sometimes it's hard, but for some people there will be certain sounds that are more challenging than others. The speech therapy progression would be to move from practicing the sound accurately, then practicing that sound in a word, then practicing it in a phrase, to a sentence, and all the way up to conversation level. So what would that progression look like if you're practicing the L sound? First, you're going to start with L, then you would move it to the word love, maybe to a sentence, I love speech secrets. And that sentence I just said used only oral sounds, which is also a good place to start if you're having difficulty, before moving to words and sentences that have both oral and nasal sounds. Let's try one of those now. Oh my, I enjoy speech secrets and nasal sounds. How'd you do? Here's my last tip. When you're working on velopharyngeal dysfunction, you're trying to change or learn a new oral motor pattern, or at least gain better control over that oral motor pattern. And this requires a lot of repetition. So ideally practice daily. Regular short sessions have been shown more effective than, for example, practicing for 1 hour once a week. The goal is for these motor patterns to carry over to your spontaneous speech. And that, my friends, takes practice. But I believe in you. Talk to your speech therapist about how to tailor exercises like these to your individual needs. And as always, be kind to yourself.